Welcome to Rich Your Soul, Marc Isaacson. It's great to have you join us today.
Great to be here.
And I'm excited to learn from you. We always start at the beginning. What was it like when you were growing up, and how much did your family and school teach you about money?
Oh, so I always say, I guess my phases of learning about money were maybe a little bit, the hard lessons of money probably older in life because I was fortunately like pretty privileged to some degree. You just, I was born in this family where we did have a little bit of I didn't have any needs. We actually had a little bit of a country club lifestyle. I got the great privilege of spending summers, going to camp, for like 7, 8 weeks in Maine, a great boys camp, and did all kinds of awesome activities. However, I would say because my dad was entrepreneurial, and he was running a business, so I think that got embedded in me. And I was always one in the family that was doing interesting stuff. Like I didn't play like Little League. I played like street hockey and some other things, but I was selling like snacks and sodas at the Little League games. And then when I ultimately got to drive, I was always working a little bit as a kid, but when I got to drive, this guy that I knew had a bagel route. You got to be in the right neighborhood to have a bagel route. But I had a bagel route, where on Sundays I was delivering bagels to like, I can't even remember, 30, 35 or 40 different homes every Sunday. And then sort of from there, and my brother and I were both into baseball cards. So we started to purchase and resell baseball cards. And we started to go to some baseball card shows, like when we were 14, 15, 16, 17, and make a little bit of money. But it was more the idea of being able to make some money. And I was lucky early on in my life, I didn't need money. But things kind of did change when I got, when I got really a couple years before I headed off to college, because my parents had some financial challenges and my dad got sick and my dad sold his business. And like so many entrepreneurs, this was in the 70s where he was really putting a huge amount of the company or the personal expenses through the business, which was like, I think, a pretty normal thing that was maybe happening back in the 70s. So when he ultimately sold his business, he really he was not an in-depth planner and not, really knowledgeable in depth on financial planning. It wasn't his skill set. So he really didn't have any idea how much he needed to earn after tax to fund everything. So ultimately that led to a lot of economic challenges and trouble in our family, as really that led to the road where my dad was always a smoker. Like I'm talking not just a light smoker, like a 3-pack a day smoker. And then that led, and he was always a casual drinker, but that led to heavy drinking when I think he had more challenges. And this was over like 5 or 6 or 7 years. And that led to crazy health problems. So this whole combo ultimately led to a really difficult time when I was just entering college, where my parents got separated and they were heading down the divorce. But simultaneous to this craziness is that my dad got really sick and he had to go on disability. So it got very super complex. My mom wasn't working at all. And my mom was like, lived in this lifestyle where she didn't know anything about work, even though she went to University of Pennsylvania, but she had never worked a day in her life. And she was now like in her late 40s or something like that. So it was a super difficult time, super challenging time. My dad my parents never got divorced, although they spent lots of money on lawyers, and the ugliest, craziest fight. I mean, that was great insight into how much money you could spend on lawyers. And at that point, because they had burned through all their cash, kind of like supporting the lifestyle that they had and not understanding all the ramifications of living like above your means. So at one point we were living within our means because the economics worked that way. My dad ran his business. All of a sudden when he sold it, we were living above our means and burning through cash. And then they got lawyers. My dad got sick. You can imagine the scenario, and went on disability. So all of a sudden the income went from like up here to like not a lot. So it caused a lot of, just incredible hardship for my family, my mom in particular.
How did that affect your beliefs around money?
Oh, it was a significant impact. I mean, look, I mean, thank goodness that because of whether it was a combination of my schooling or just my reasonable understanding that you couldn't do crazy stuff like live beyond your means, and just getting that insight of the distinction between having this incredible, very high, everything you want kind of lifestyle, and then really over a course of like 4 or 5 years, going from almost doing like anything I wanted to do to, 4 or 5 years, when you're a kid, it's a good amount of time. But I mean, the shift of what happened, and really, I mean, look, I also got lucky in that timing because I was really almost heading off to college when things started to transition. So I was at that point, understanding that I had to, work some and I was fortunate that it didn't. I had a younger brother who was 6 years younger, so he got way more significantly impacted. And my mom, who was in the middle of the whole scenario, trying to take care of my younger brother, it was super devastating. So it taught me a lot of lessons about, what I thought about money and how I would live in the future, about, saving and investing and managing to a budget.
Did you do anything different with your kids?
I would say 100%. So first off, we never lived at this like well beyond our means or this crazy lifestyle. But I would say with our kids, probably that the most one of the more impactful things we did is if they wanted something, and my son was like an expert at this, my oldest son, even early on, like if he wanted something, we made him understand, there were basic things that we were getting him. And then there were birthdays and other events. But if he wanted something, we made him realize that he had to save gifts from other people and maybe put that towards something, or figure out ways that he could work with like the grandparents and the aunts and uncle and get them to like jointly contribute together. And if he had some money saved, he would have to throw some money in the bucket and stuff like that. So like anything that he wanted that we thought was, outside of the norm of something that he needed, like things like, it could have been a Game Boy, it could have been, as people get older, they want more things. It's like even a car. I mean, like he had to save and put money in, and then we made him responsible, for like paying for there were things that we were willing to do, like cover his car insurance, but he was responsible for stuff like maintenance and putting gas in. And if he had a payment, he had some responsibility for those kinds of things.
Well, and it sounds like you raised him financially savvy.
Yeah. I mean, look, so the greatest thing is, and the other thing that my parents definitely did not do is they did not share a lot with us, like on investments and where to put money and the important lessons like time value of money and the power of incremental investing over time. So we were pretty much, I would say, an open book with our kids in terms of, how we were, why we were doing what we were doing, how we were like effectively, we have allocations of how we were saving for college and how we were saving for retirement and how we were, saving for like our travel and activities and all those kinds of things. And how, we were putting things in different buckets. And because of that, so the greatest thing that happened with my kids is my son early on. This is actually a great thing too, that not from my parents, but when I got married, my mom's my mother-in-law, whose name was Babs Isaacson. So this was really terrific. She was in an investment club. So she was the one in the family that was really encouraging the kids on a level to save. So she did the ultimate matching program that she would never allow me to participate in. I don't know why, but she let the grandkids do it. So she said to the grandkids, listen, something like, I think it was like every dollar you put in to investment, I think she gave $2. So they got a 200% return right off the top. So So my son, who was my oldest, which was great because then he became the role model. And this is when my mother-in-law was healthier. She was educating him on investing, which was really cool, and trying to figure and show him how you pick stocks and stuff like that. And I was expressing to him, Dean, and then because I used that, I said, Dean, you've got to understand, this is like a once in a lifetime opportunity. We talked about return on investment and how you couldn't go bad. You're greatly reducing your risk when you're putting up $1 and someone else is putting up 2. Or ultimately, obviously, but then it relates, but it's cool because then you get in and you talk about how it relates to like 401k. And potentially, if you're working in the right place, you're running your own business and you're doing like 401k match, and how you get instant ROI on that. So once that happened, I had a daughter that was a couple years younger, and she was like on the bandwagon and just like understanding this stuff. And she became super passionate about financial planning, my daughter.
Yeah. Well,
And my son, to some level, my daughter's super passionate. So they always, then as they got a little bit older, I mean, look, my son is 27 now, my daughter's 24. But I mean, I'm talking for the last 6-7 years, even before
they're on top of it.
working almost, they were, because they had this, upbringing, and because of the process, they were, saving now in their early 20s or whatever, late teens for like retirement and, saving for travel and putting money in different buckets. So. Yeah.
Smart move. So you kind of followed your father's footsteps and went into business. What was that like?
Yeah. So, everyone has their path. So I always, for whatever reason, never like had this desire to work for, it was my innate thing. And I did have a great fortune of hanging around my dad and learning a bunch from him. So, so it was great. Listen, the first thing I did is I went to work for another entrepreneur who was like an early on mentor. His name was Elliot Hirsch, and he was running a beverage company in Glenside, Pennsylvania, called Elliot's Juices, right outside of Philadelphia, which is where I grew up. And I spent like 3 or 4 years there. Really, early on, it was like maybe $1 million business, and when I left, it was 8 or 9 or 10 million. So specialty beverage company. So it was super cool. I had early on a lot of responsibility, like running like the marketing area and involved in sales. So it was it was a great experience for me because I was always very good with numbers as well. So I could help him out, even though he was a controller, but I just had this God-given little bit of good ability understanding numbers. So I could always help him do projections and budgets and, that kind of stuff along the way. So that was just that was super foundational. Went to school at Ithaca College, undergraduate degree in business. That's kind of where I got my overview training. And then with the help of Elliot Hirsch, but I learned the beverage business. My first company was a specialty beverage product. It was like juice and spring water. That because I spent, and that's where the mentoring thing came in such great help, finding mentors and learning a business and learning distribution and getting that awesome experience. And I could use that. I was able to leverage my network and my sales and my distribution channels that I learned about along the way to launch my beverage company that I did in I guess it was the late 80s, early 90s.
And so what was it that got you to shift from the beverages and got you interested in nutrition?
Yeah. So the beverages that I was doing were all like spring water and juice combinations. So I was always into a little bit of this healthier oriented movement. And because of that, we were selling products into natural food stores, other locations, but natural food stores. And the natural foods business, the big conference related to that was called Expo East and Expo West, where these are all the manufacturers that supply places like Whole Foods that people would know, and all these smaller or medium-sized natural food store chains. So I started to go to those and just got super interested in this whole concept of nutrition and the beverage business. So what I learned about the beverage business is, and I built that up to several $1 million, but what I learned about the beverage business was these were heavier products they were heavy beverages. Most of the things I was selling was in glass bottles. They were heavy and they were low value items. So you couldn't ship them in the mail, right? And you had to go through in that business, and this is a great insight for me. you had to go through what I would call 3-tier distribution. We would sell to the distributor. The distributor would then sell to the retail store, and the retailer would sell to the consumer. So we never knew who the consumer was. And it was super hard as an entrepreneur with not a lot of cash to be able to influence the consumer and the buyer. And through that process, and it was also an easy business. There were relatively at that time lower barriers to entry, because you could go to a contract manufacturer who was running some sort of product like yours, and for 10, 20 grand or whatever it is, you could get like a beverage made, kind of like mine, and copy me, without a lot of significant barriers. So I just had always, and I always say, related back to my dad. My dad died at 59, sick, who knows what. But this is really, this now is more than a decade after he passed away that I really said, from the natural product shows, I started to get very interested in nutrition and health, and like foods as nutrition and medicine, and just vitamins and minerals and amino acids. So as I decided the beverage thing that was cool and a great foundation, I wanted to exit that and find a business that was somewhere I was very specifically interested, as I said, in the vitamin, mineral, amino acid, personalized, the nutrition kind of space. So as luck had it, I had during that period of time, Rocky, I know this is some of our connection, I joined EO when I was running my first business, my beverage company. And EO was an incredible experience. And at that point, it was YEO, Young Entrepreneurs Organization. So that's when I was in my, whatever I was then, in my mid-20s or so, late 20s when I joined. And that was like the incredible opportunity to only hang around entrepreneurs. The criteria was you have to be $1 million in revenue. And we had forum, which is effectively advisory boards in EO. So every single month, there were both chapter events, there were national, regional events. But the most powerful thing was there was a group of 7 or 8 people, other non-competitive businesses. We were meeting once a month for like 4 hours, going over each other's businesses, supporting each other, problem solving. I was getting this collective wisdom. It was effectively my board. And that was a super powerful thing that I did. And that just gave me a bunch of clarity. And then I went on and I exited my first business. With my EO network and other guidance, I started looking for specifically, I didn't want to start another business. I wanted to go the acquisition route. And through my network, I found this very interesting, what I call today an integrative pharmacy in Bethesda, Maryland. I was still originally in Philadelphia. And I found this integrative pharmacy that was doing nutrition and customizing super interesting nutritional formulas and either prescription drugs customization, which I never knew about. So I wasn't looking for a pharmacy, but this was a location that was actually doing prescription drugs with pharmacists taking insurance. And then they were super unique because at that point, 50, 60% of their business, 70% of their business was doing nutrition related products. And that's kind of how I moved over.
Interesting. So once you got started there, you actually kind of lucked out because you had some health issues with your family, right? That you were able to.
Yeah, this was. Look, you never know what life. This goes in the category for sure. You never know what life brings you. So at this point, when my wife and I moved to Maryland, I had a, give or take a little bit, 5-year-old son in kindergarten. I had a 3.5-year-old daughter, right, who was still at home. And fast forward, 8, 9 years later, so I was well into my business. I've been running this business like 21 years now. I guess I was a solid, 9 or 10 years in this business. We had a younger daughter who was born in Maryland. Her name is Tess. All of our kids, always healthy, doing athletic, great, generally speaking, great with relationships and all that stuff, athletically, academically, all that stuff was good. And out of the blue, when my daughter was 8 years old, we were in Philadelphia visiting family, and she went to bed, and someone went to check on her, and she was suffering a grand mal seizure out of the absolute blue, no family history. So what do? doesn't matter who you are. We didn't have any doctors there. We called 911. The paramedics come out, the whole 9 yards. We rush her to the hospital, and then all of a sudden she comes out of this seizure activity. So really, the scariest thing I've ever seen in my life, if you see a kid who's like seizing and their eyes are rolled back, just terrifying, and you can't stop the seizure. I mean, so the seizure went on for 8 or 9 or 10 minutes. We don't even know how long until the paramedics came. And it kind of stopped when the paramedics came. And then all of a sudden, my daughter was a little bit drowsy, and she's all of a sudden on a gurney out of the blue. So she has no clue what happened to her. So she's like crying and, doesn't want to go to the hospital or doing these things. So fast forward, we end up going through all this testing, and she was diagnosed with childhood epilepsy out of the blue. And then all of a sudden, from having no seizures, and maybe we could have missed some along the way, but as far as we know, we didn't know. For months and months and months, every month, usually at nighttime, usually it was kind of odd seizures work in different ways. But for her situation, it was like once, 1 week a month, she might have had 2 or 3 or 4 seizures. And then she might go for 2 or 3 more months and be fine. And that went on for like 3 years. And what did we have to do? I was running this business and I was in the right place, but we had top level pediatric neurologists at Children's Hospital in Washington, D.C. And they said, look, you don't really have an option. We don't know of any other option. There's no fix that we know of, except to do the traditional route, give her seizure controlling medications. And we went with like the lowest dosing level. And then because I'm in this unique business where we understand in many cases, 80% of all these chronic conditions, there is a why behind what happens to people. With seizures at this juncture that we were in, these docs couldn't tell us why, but we work with what I would call systems biology, functional medicine, medical doctors, clinical nutritionists, all these people that are licensed and degreed, and research biochemistry and understand how biochemistry functions. And in many cases, for a lot of people, it is foods or it's nutrients or it's lifestyle or it's toxins that are key culprits in some of these things that happen to them. So with our daughter, we ran through all kinds of different testing, all kinds of different it's like any parent, right? I mean, you've probably heard stories like this before. Any parent, if something happens to their kid, they will become their greatest advocate. And I just happened to be in a place where I had doctors all over the country who were like brilliant people trying to help me sort through this stuff. So 3 years of this process going on with seizures and my daughter still on medicines, right place, right time. I will say the right acceleration of knowledge and convergence of data, which included understanding genes, understanding biochemistry, and understanding all this lifestyle data that we could look at for the first time and get more clarity. And it turns out with my daughter, one of my docs and a clinical nutritionist, very smart, came to me kind of at the same time. They didn't know each other. And one of them said, my doc said, hey, we can really look at genes now to another level and look at if my daughter's detoxification pathways to understand how's her body deal with like all these toxins we bring in through the food supply and air and water and all these different places or cosmetics you put on your body. And it turns out that my daughter, when we ran all these genes and labs related to it, she had some compromised and poor detoxification pathways. So that was part 1. And part 2, Rocky, was that the next question is, what are those toxins that are maybe disrupting her? So I had a clinical nutritionist that was super bright, and we were talking to her, and she had the ability, through some testing and looking at some biochemistry and some other things, to help us identify specific toxins. So this is where it's really crazy, because when people talk about toxins, so she was compromised, right? We knew that she was compromised. And the cool thing is, we knew that there were steps that we could take. You can do hot baths, you can do mineral salts, you can exercise, you can do saunas, you can take certain nutrients, you can clean up your diet, and maybe eat more organic. But there's a handful of steps you can take if you're compromised from a detox perspective, which tons of people are in today's world. So that was one thing that we started to do. But the second thing that was super interesting is that this nutritionist helped us explore and understand that my daughter didn't have what would first jump to mind as big time toxins. It wasn't like she was overloaded with pesticides, or she was overloaded with heavy metals, right? Because that's what a lot of people might think when they're thinking about toxins. But the interesting thing is foods can be toxins for certain people. Now, people might understand like things like peanuts, nuts, and they might understand dairy or gluten, or shellfish. I mean, some of the most common things. What's super interesting is there are all these categories, even today. This is almost a decade later, 8 years later, a ton of people have no idea about. So my daughter's issue was related to sulfur. Her sulfur, detoxification pathways were the biggest part that was compromised. And sulfur is in a ton of superfoods, like cruciferous vegetables, broccoli, cauliflower. You follow that? In garlic, in turmeric, in grass-fed, clean, like organic eggs.
Isn't it also in medicines?
So look, sulfur can be in wines. So this is 100% true. Medicines, absolutely. Medicines can have things like there could be sulfur-oriented things maybe in medicines. Listen, medicines for a lot of people, the reason why medicines cause side effects, there could be all kinds of interesting fillers, binders, allergens, what would be called excipients, the food dye or the coloring or something like that that someone puts on a medicine can be an issue too. So yes, there's a whole host of different things that could be problematic with medicines. But of course, this is all based on what we'll talk about a little more, but it's all based on about the theme of personalization. Absolutely. So my daughter, to give you the final analysis of what happened with her is sulfur was her biggest driver, the biggest toxin to her. And she was eating eggs like all the time. And there's also some people have problems also like processing fats, like even great fats like fish oil and olive oil. And my daughter had a little bit of a problem there as well. So when we realized those couple things, we just reduced and really removed the eggs. And we did our own little detox process with some nutritional support. And she was taking baths with some mineral salts and so forth. That was our little shift from 3 years of having seizures all the time. It was like a snap of a finger. When we understood her biochemistry, which is one of a kind, we were able to shift all of that and the seizures stopped. And the seizures have been good for like 8 years. And when we first got diagnosed, the other thing Rocky and everyone should know, I mean, the docs and the system in the US, unfortunately, is focused around, so there's great things about it. If you have a heart attack, if you're in a big accident, right? If you need emergency room care, really, a critical accident, whatever it might be, you need this healthcare system that we have, no doubt about it, right? And for certain other things, there's some amazing drugs now with cancer and other areas you need, but about 80%, the data says 80% of what's going on is 100% fixable. And that's kind of the message. But the critical thing is people do not realize that our healthcare system only really diagnoses you. And for the most part, the model is you get a medication. So in mental health, which we can talk about later a little bit, but in mental health and with most of these conditions, the data is like 90% of prescription drugs mask the symptom. Manage the symptom. It's called disease because I run a pharmaceutical company. I've been all the or a pharmacy, and I've been to all these events. And on that side of the business, the model is, anyone that's got a disease, let's figure out the 3 or 4 or 5 different prescription drugs they need to help manage that disease. It's not focused, as again, 89% of it is not focused on fixing you and getting you off those meds. They want to just manage you so you'll take that stuff forever. And then sometimes those things cause side effects, right? So about 30% of those things help to manage the symptoms. Sometimes they don't even do that. 60% of that 30%, 60% of the people that get some benefit get side effects. And then in many cases, people know this inherently and people hear the stories. But then sometimes you got to get extra prescriptions to manage the side effects that are happening from the first couple prescriptions that you're taking. And it's like this crazy domino effect. So once you take 3 or 4 or 5 prescriptions, because everyone's got such unique biochemistry, you have no idea how that's impacting your biochemistry. So that's So that's kind of the story of my daughter relates to this whole notion. And then you can ask me any question you want, but this is really the critical highlight of this, is we are now at the point, we have trademarked a word called epibiogenetics. We say that those are probably the three most important sets of data that make you one of a kind and that we can understand today. So of epigenetics, epibiogenetics, is epigenetic. That's all your lifestyle stuff. That is like taking prescription drugs, which is part of your lifestyle. Do those prescription drugs cause side effects to you? But epigenetics relates to the food you're eating, relates to the toxins you're bringing in, relates to all this lifestyle stuff, stress, exercise, water consumption, alcohol consumption. Are you smoking? Do you have secondhand smoke? Are you working in a bad environmental area? Like farming could be really detrimental to people, or some of the trades can be very detrimental to environmental impact on people. So that's epigenetics. So epi then impacts your biochemistry. So your biochemistry is all the lab work. And so no one's got your same epigenetics in the world out of 8 billion. Nobody out of the 8 billion people has your same biochemistry. And when it comes to genetics, right, epibiogenetics, DNA, everyone knows no one's got the same DNA, except if you happen to have a twin, identical twin. So because you've got those three buckets that are all one of a kind to you, it just says our healthcare system generally has a one-size-fits-all model. It's not designed for each individual. And if you understand that, that's the game-changing understanding to say, oh, because then all of a sudden, the nutrients that you need are different from anybody else on the planet. The foods you need, your most important foods to eat and not eat, generally speaking, are one of a kind to you. There's not like all these different fad diets. There's only one diet for your biochemistry. And then it gets a lifestyle and detoxification, things like that. But we're at this, emergence, which is what we figured out with my daughter, that, it was a one of a kind approach. Just because it worked for her doesn't mean it's working for somebody else, but it could be 50, 80, 100 different things that's impacting somebody else, but maybe causing those same seizures. You just don't know until you dig in and you test. It's one of these categories where you really got to test and understand that person's biochemistry. You can't guess.
And most of our current medical system does not do this kind of testing. Exactly. And if you're seeing multiple specialists, they're each handing you drugs that may cause trouble with other drugs or other issues, and none of them really tend to coordinate all of that and ensure that you're getting what's overall best.
Rocky, you're on. I mean, that's the complexity of. And that is really complex, because I've seen this in prescription drugs all the time. And I can even give you my simple example. My father-in-law, who, when he was sick, to your point, exactly, he was seeing like 3 or 4 specialists. They were all giving him a couple different meds, right? I talked to his primary care because I said our pharmacy team can review all of this. So we had no point person. And the primary care physician says, hey, if the specialist is giving him some meds, that's the specialist who has that expertise. Me, as the primary care, I'm not in the place to tell him to do something different. But it's 100% nobody is looking. When he was on 16 meds, there is no way in heck, even if you're the smartest, even with AI, you can't figure out what all that stuff means. And it's super tricky. I mean, the best bet is, I always say, the business that we do, unfortunately, it's not the lead. The lead is you go to your primary care. My mission is to bring what we do into primary care, because it should be the first step. In Europe, in other countries, much more often than any in the US at all, there's at least much more preventative focus. In the US, I think the data is like crazy, like 90% plus of anything that happens in the US healthcare system. I think that's the data, is not really focused on prevention, even though 80% of all this chronic disease can be fixed if we changed around the model, which is obviously not easy to do given insurance and the drug companies and all those people that have their stakes in the existing model currently.
And a lot of preventative care is probably not even covered by insurance.
That's correct. Like that's
Preventative
other
screening might be,
Jane
but
Fonda.
not.
Oh, I mean, 100%. I mean, these things that are, look, medicine is medicine. Doing screenings, very important. The big thing is that the doctors and the system never looks and says, what do you do to fix the body? The system is about disease state management. Fixing the body is about nutrients. It's about enzymes. It's about not detoxing or not taking things that are toxic and understanding that toxic to your body and understanding that foods are medicine and understanding that foods can be game changing in terms of being super helpful or super detrimental to you. And the system, I mean, that's just, hopefully, look, I'm encouraged. I'm the eternal optimist, I would say. I mean, it is making progress. More and more people are seeing this. Social media, the movement, I think, is coming. Lots of stuff is going on, and I'm optimistic it's going to be drastically different because we could save, if 80%, if your audience doesn't know, healthcare today, this is like the financial numbers of all this stuff. Healthcare today is over $4 trillion. That's with a T, $4 trillion. It's approaching 20% of the whole U.S. economy, GDP. To make it simple, I saw this data that this is like super scary, but I can see this happening. But I saw this data saying that like within 20 or 30 years, it might become 40% of GDP healthcare costs. So who knows? But it's even today, forget that. It's totally not manageable. Totally. Is there, if you took a survey, how many in your audience would say, I love our healthcare system and I love paying all the money that I contribute to the healthcare system? How many people do you think would raise their hands and say, bring on more of the existing healthcare system?
I don't think a lot of people have a clue of how bad it actually is.
Yeah.
And I know what it's like on the inside. And I know that it's not, it's not great. And again, because there's so much money in it, there are so many, I don't know if they're bad actors or selfish actors or.
Well, there's a lot of people that have their agenda. It's like there's all this stuff. If people start looking around at PBMs, and I'm having a major problem with the PBM because they want to take money back from me. It's a long story with COVID test kits because we filled them according to the Biden mandate. But these PBMs are like middlemen and they're like adding all this extra cost. And there's no great reason to have a PBM in the middle between the pharmaceutical companies and the community pharmacies, because all they're doing is taking markup and they're trying to capture profits and they'll do these audits on people and on little nuances of the contract, which are really, for the most part, in most cases, inconsequential. They will say, oh, you delivered this prescription drug to someone 2 days early, so we're going to take back the money from you. So it's total. It really is madness. And when I talk about this $4 billion, the other number that people should really understand is that not that you're ever going to get there unless we really turn the system upside down, but 80% of that 4 trillion, which maybe is close to 4.5 trillion now, but 80% of that is it's actually 80% of all the costs of like chronic conditions and 80% of the chronic conditions. So it comes down to like 60+% of our healthcare costs today. Might be a little bit higher, but that's what's fixable. Fixable without prescription drugs. I'm telling you, that's what's fixable with all the science. And if someone wants to Google PubMed and do all the research, I can tell you for sure, 80% of all these chronic conditions, which is about 60% of healthcare costs, that's what's fixable. And when I say fixable through foods, nutrients, lifestyle, doing these things that we did with Tess, on understanding what's toxic to her and getting that out of her system.
So how do people figure out what's toxic? How do they figure out they're unique?
Yeah. So, I mean, the truth of the matter is it's not overly, look, I'll tell you two things on this. So one, ultimately, you start at the highest level and you say the goal is to understand what's the stuff I got to take out of my body that's no good what are the things that got to come out, and what are the inputs you want to have come in. So you optimally do a combination of some regular labs that you're doing in primary care that will be covered. And then there's some really interesting things. I'll talk in a moment. I guess we can talk a little moment about this really
Yeah, you
interesting
can talk
brain
about it
things.
now.
Yeah, but we will tell people there's two incredible areas that give us understanding on what to do for you in terms of testing. One is your gut. People talk about microbiome, gut health, leaky gut, but your gut, they call that like your second brain, right? So we're going to talk about your first brain too, but your second brain. But having your gut right and not having yeast and all this overgrowth and bad bacteria and just the negative stuff in your gut, fixing your gut up so your gut can take in all the right vitamins, minerals, amino acids, enzymes, all that kind of stuff, break down everything and deliver it to your whole body is critical. So there's some testing you can do there. That's one. Number two is the brain is the brain, and you got to get the brain. You always want a healthy brain because the brain is controlling so many systems in the body to start with. But we're doing this incredible stuff now that you and I talked about a little bit previously, where we can look at 5 traditional blood draw markers, which are like things like whole blood histamine, zinc, copper, another blood marker, and something called pyrroles, which is just a urine test. So this whole test is a couple $100, but you've got to have an expert that can interpret the test, and then a nutritionist that can work with you to figure out what to do. So call it, a little bit less than $500 to do, everything with consults and so forth. So unfortunately, that kind of stuff is out of pocket, but it's so game changing because it means for people that have mental health issues, for people that have addiction issues, potentially for people that are concerned about long-term cognitive function and just want to do the basics to optimize the brain so the brain can help to optimize your whole body, and help to manage your body as best as possible. In doing this testing, we can then, and this is what's crazy, again, I'll give you the quick pharmaceutical comparison to the lifestyle. In the prescription drug realm, when it comes to brain chemistry and mental health, approximately, based on the data, 30% of prescription drugs are helpful to people in managing like mental health and addiction types of issues. 30%, they manage the symptom. They never get to the root cause. And out of that number, these are approximates, about 60% of people that get some benefit, the 30% that get benefit, about 60% will have side effects, right? So that's the pharmaceutical model, and they're managing those symptoms. And a lot of people, but then there's 70% of people that even they take those drugs, never get help. And look, some of those people for sure also in that model are getting help because there is absolutely value in talk therapy, having a psychiatrist, a psychologist, a social worker, somebody who can really be a coach for you. But that's kind of the combination of what our traditional healthcare system does today. The most incredible, crazy thing, and my passion, what our company has been doing for a decade, and for the first time more than decades, maybe approaching 15 years, is this lab test I just described to you. We, in our compounding lab, there's only, in the neighborhood of only 20 vitamins, minerals, and amino acids that are the building blocks. Those are the raw materials. That's it. Those are the building blocks and raw materials that you need to repair the brain. And you need to balance things like dopamine, serotonin, GABA, your key neurotransmitters, which all have to do with mood, all have to do with mental health, have to do with addiction. And then there's this whole brain process. I don't want to get down in the nitty gritty, but there's a whole main brain process called methylation, which is related to reducing the risk. The most important thing is it's related to reducing the risk of gene expression. And in that case, we're talking about the wrong genes with maybe the wrong conditions expressing. It has to do with detoxification. It has to do with reducing inflammation in the body, optimizing the immune system. So just in summary, it's super cool stuff. But at its essence, this test is simply just looking at your brain chemistry and understanding if it's imbalance or not imbalance. And 95% of the people that take this test, their brain chemistry is not imbalance. And the only way to fix that balancing is these 20 some odd vitamins, minerals, amino acids. And what we do, we take that with some medical doctors and even master's degree clinical nutrition, but most of the interpretation is done by doctors who interpret this lab work. And then we don't make a pill and say, oh, we're going to put all these different 20 vitamins and minerals together for you in a pill in one set dosing level. The art and science to accelerating recovery for mental health, and what this piece of the puzzle that I call the missing link, is we then customize. We figure out which of those you need. And specifically, we do it in two ways. One, we figure out what you need in the AM. So it might only be 3, 4, 5, 6, 7, 8. It just depends on the testing. And the dosing of each of those will be different. So you have a one-of-a-kind AM formula because, as I said, your brain is one of a kind. Out of 8 billion people in the world, no one's got your same brain. So it's the same kind of scenario you've got to customize for that brain. And then same thing in the PM. There's certain nutrients that work best in the AM, certain that are delivered best in the PM for you. And then you get a secondary one-of-a-kind personalized formula in the PM. And this is the difference. So 30% so at the end of the day, when you do this, 30% of prescription drugs manage the issues for people, 30% effect. With this, the data shows us that it's not fixing everybody, but 80%, it's almost 3x, 80%, you're actually fixing the root causes. So after 4 to 6 months, this is a 4 to 6 month process because we're transparent about this. It takes 4 to 6 months potentially to do all the repair work that the brain needs, to repair and fix itself. And after 4 to 6 months, 80% of those people have super, really solid results. And I would never want to overpromise, underdeliver. Some of the people, it's transformational. It's night and day. Some of the people, it's really good progress, right? And there's 20% of the people where it's just not, for whatever the reason is, we don't really understand it, but whatever the reason is, it's not a significant needle mover for them to do this.
So why isn't this more mainstream? Why isn't more of the healthcare system focusing on this and spending time here?
So look, I would tell you at its heart, it's the model that we've built. It's the docs. It's driven more by, the collective model and influence of the prescription drug companies. They're the guys that make all the profits because they've got the patented ingredients and they've got the insurance companies that are willing to reimburse not just hundreds of dollars, not just thousands of dollars at times, but for a bunch of these specialty meds that are going to destroy the economics in the healthcare system already are. There's people that take meds now. Just look at Ozempic. Let's just talk about what's happening today. Ozempic. But this is just one little thing. Think about this. One person in a family who is either going to maybe have type 2 diabetes and get the doc to sign off and get that Ozempic, which is $1,000 a month or $1,200 a month. Think about it this way. Most families today, most individuals are paying $600, $700, $800 a month for healthcare. Most couples might be paying $1,200 or $1,300 too. Most families today are paying, honestly, past $2,000. It could be $2,200, it could be $2,500. I'm talking a month. So when you look at something like Ozempic, and that's only one prescription drug out of billions and billions and billions and billions of dollars of prescription drugs. But this is a prescription drug that so many docs are signing off on. And if you have one member of your family who's taken Ozempic and you have 4 or 5 kids, and now they're doing more research for kids on this drug, right? So, it's just, we got 50%. I think it's type 2 diabetes is like 30 or 40, I think there's pre-diabetes like 30% amongst kids, maybe obesity 50%, but it's huge numbers, right? That Ozempic could start to be used, maybe it's in lower dosing for kids. But the economics of the model, as I said, if you have a family of 4 or 5 and one of them happens to be on Ozempic, that's close to like half of your monthly premium is going to one prescription drug for one person in the family. right? I mean, it's just the whole dynamic that the prescription drug companies have built this model that they've got legislature, they've got ads, they've got doctor outreach and education, they've got obviously congressmen, senators that they're funding, and they never want it to end because it's been the biggest cash cow ever, and they got huge lobbying, huge capabilities to control and influence the whole system. And I would say that's a huge amount of the system. And then all these other people just tag along for the ride because, they can all make their, the big pharmacies like CVS or whoever, they can make their share of money. They buy Caremark that's in the middle and they try to disrupt independence so CVS can get more business. And then they allow CVS to buy Aetna, and Aetna, is directing all the customers and clients to CVS to get the prescriptions. I mean, it's just a crazy, if that makes sense, but it's a crazy system.
No, I having been part of it, I know what it's like on the inside. I know how crazy it is. I know how much money is involved. But I also know the other half, which is patients come in, they don't want to hear the words diet and exercise. They want to hear, give me a pill.
This is true.
And so they are just as much to blame.
There's a bucket, right? There's the docs that don't know and aren't educated in what I would call as a systems biology, getting to the root cause and doing a one-of-a-kind approach that has the data behind it. And you are 100% right. There are consumers, absolutely, that want to take the easy path out. And in my mind, I get that. So this is where there's a lot of work to do because the system should be changed. The incentives should be changed. The rewards should be changed. There should be more pain if you're not doing certain lifestyle things. There should be more pain, and there should be higher payments and higher deductibles. I mean, this is the way. This is a big structural thing that, of course, the prescription drug companies and other people would lobby against forever. But I mean, the truth is in the results. So I'm, deeply working on figuring out ways to do this more economically, do this easier, for people, make it more accessible and so forth so that we can get more proof and we can get more momentum in what we're doing.
And the reality is what you talked about as far as the cost of testing is actually pretty inexpensive.
So listen, here's also the dynamic. What we're trying to do for brain chemistry, like we're trying to make it a great entryway that could really almost show proof of concept of how we can change the mental health and the addiction craziness that's going on, because we can make a big impact. And we can impact probably 70, 80% plus of all the people that are out there today with addictions and mental health issues, struggling, or a really significant, or, certainly from a test perspective, but to go deeper, and this is what I think everyone in your audience should know if they don't already know, to go to the next level and do what I would call like a full understanding, because you want to get your digestion and your gut right and your microbiome right. And you want to really understand the nutrients. So we can tell you the nutrients for your brain. And some of those are 100% related to the rest of the body, but that's not all the body. So there's another really great test that we will help people do, which is called NutraVal, Eval, EVAL, by a company called Genova. So we can help anyone get that stuff as economically as possible. But that kind of test is still going to cost people. Now that's another test, like $550 or $600. It's not terrible, but for a lot of people, it's not covered by insurance. So, and then there's probably another couple $100 on top of that to have someone do the interpretation. And we're trying to figure out from our team to figure out how we then do brain chemistry and how we maybe package a couple of these things together to make it as economically possible, to people, as economically reasonable to people to go down this road, because it's game changing for, it's night and day, when
how much of ADHD is either treatable or preventable?
So look, I'm not in the claiming of preventable and treating, but as I said, I mean, I think that the simple thing is I would go with the overview and say the combination for so many of these conditions in the mental health, the balancing of neurotransmitters. Remember, I said the balancing of neurotransmitters. Key areas, some of the biggest mental health areas: ADHD, depression, anxiety, right? There's more difficult things like bipolar and schizophrenia, not as common. Balancing the brain chemistry. The data shows for those three things, like at any age, 75 to 80% can, depends on the person a little bit, can be significantly improved. Sometimes, I mean, it's totally transformational to people. With things like autism, and I should make sure that if anybody, and the data on autism is absolutely crazy, where a handful of years ago it was whatever, 1 in 1,000 or 1 in 500 or 1 in 200, and a handful of years ago I think the data was 1 in 100, and then it went to 1 in 66, and I think the most recent data, if I have it right, is like 1 in 33 are now diagnosed with autism. So this work that we do on optimizing brain chemistry and neurotransmitters and balancing the rest of the brain off with methylation and so forth, it is critical, especially with autism. Early, you got it to really make a big impact with autism. From the docs that we work with, this isn't coming directly from me, from the docs that we work with in this area, up until the age, it's super impactful if you can reach them before the age of 6, kids that are autistic, because their brains are just growing and developing. And if you feed those brains, the right building blocks and nutrients and raw material that they need, you can make great impact. What could be life transformational impact with those kids? It just depends. It still depends. But younger age, yes, up until 12. Then the window closes the closer you get to 12, 13, 15, Whereas with things like ADHD, anxiety, depression, other addictions, other mental health issues, the good thing is with all these other things, the window is really open because you can repair, at any time, any life stage. You can repair and make the world a difference for people. Yep.
Well, I think people are going to have to figure out for themselves what they want to do, whether they want to get tested. And honestly, to me, it's worth it to spend money. And I've spent a ton of money on my healthcare to do things that normal medicine doesn't allow you to do or prevents you from. Yeah. And I mean, for me, I'm looking at it from a health span and longevity standpoint. We can't make ourselves live longer, but I can be a lot healthier 80-year-old versus somebody else. And, and that's kind of my goal is to keep health.
Right. I mean, you look at people that are constantly, doing the basic buckets of things, the right kind of exercise, managing their stress, eating the right kinds of foods, doing some of the right things with nutrition. And, there's data that absolutely supports that. For sure.
Definitely a game changer. What's your secret to living an abundant life?
I am super oriented with my family overall. It's always, community is so important, and research and data shows that, besides the point. But my upbringing was always doing a lot of family events. So was my wife's. And that's been like a tremendous thing where we've always, we do, family dinners, have friends, family, whatever, other people over Friday nights, and, we try to do, obviously, travel events, memorable experiences, those kinds of things is a critical thing to me. And obviously contribution, I would say I'm one of the more blessed people in the world because I've found like a super cool area of work where I never really want to retire, because we've transformed, tens of thousands of people that were just struggling for years and, with stuff that they didn't have to struggle with. And they came to us, unfortunately, as a last resort. And as I said earlier on, this kind of work should be like the first resort, because we can understand right on early on what your risk factors are and address those early on in life to reduce risk of bad stuff happening.
What did you learn later in life that you wish you would have learned sooner?
Oh, it's always great. Look, if there's always so many things, but I think, I've got adult kids now, almost adult kids. My youngest is 19 years old at Chapel Hill. And that's the one that had the seizure activity, who's doing like unbelievably fantastic these days. But just spending time with people, just this whole notion of being a big time giver and figuring out, look, I think there is this whole innate thing as you age, more people think more about their mortality and think, what is their end game and what do they want to be known for and left with? Look, so as I touched on a moment ago, community, family, supporting people. I 100% want to make a huge difference in people. Look, as I said a moment ago, my work life kind of stuff. I mean, I'm fortunate as heck because there isn't a person, generally speaking, that we can't help, really. And in most cases, we transform these people, even neighbors, friends that just come to us, and they have no idea. And it's, look, we can contribute and always like giving more. I'm working. This is my personal focus now. Giving more, contributing more, sharing my knowledge base. And I wish, it'd always be great if I could step back and have all the knowledge today, because I would have never even messed around with my beverage company. I would have been 100% all in, but you can't, you got to live life. It's part of the journey, right?
Yep. It so is. So since you have a 19-year-old, if you were to give an 18-year-old one specific piece of wisdom, what would it be?
Oh, like I love to, here's my thing is parenting, because I think that ties to the 18 or 19-year-old or all my kids now. I would tell people to experiment. I mean, I'm talking about experimenting career-wise, right? See the world a little bit, travel a little bit, get insights of different cultures, find things that you have some degree of interest in. I mean, I got lucky. I'm interested, got some passion for it, but experiment with different things, because the hardest thing is trying to figure out, like, this is when I'm interviewing people. I'm always interviewing people for two things. What stuff that you love to do, or that you pretty much like to do a good amount, and you're good at it. Right? So that's the magic, it's like, that's part of EO and all this stuff. What's the book? I'm not thinking of the, it's putting the right people on the bus, built to last. I think it's maybe built to last or whatever, but it's the trick for anyone, like an 18-year-old or any of my kids. We've tried to, all along as being parents, we've always tried to, they're interested in this. Great. Let's let them experiment with that. As long as it's safe, they're interested in this hobby, or they're interested in this sport. We tried not to ever put limitations on them and say, you can't do that. Right? Because I think that's the mastery of this experimentation, is ultimately where you get an understanding of what you're good at, what you like to do. And I think that will super help anyone in their careers.
So true. If people would like to learn more about your company, the testing, get involved with it, how do they do that?
Yeah. So best way is obviously our website, which is Village Green, VILLAGE, and the color green, myvillagegreen.com. You can go there. You can always email us at info at myvillagegreen.com on any of the stuff. But if you go to our website, you can drop down a menu that says resources, and right away you can see lab tests there, and click on that. And you can see some of the lab testing that we do, but specifically this brain chemistry testing, which I would say, if you're only going to do one thing, that's like a phenomenal starting point, because you'll get a whole world of incredible insights.
Thank you so much for joining us today.
It was great. Super interesting. I greatly appreciate you having me on and sharing. And hopefully this can be helpful to your audience and your tribe.
Most welcome. Thanks for checking out this unedited video of the Richer Soul podcast. You can find the full episode along with all the back episodes at richersoul.com. This podcast is brought to you by Profit Comes First, where we help business owners to have a more profitable and growing business so they can live the life of their dreams. Check that out as well wherever you listen to all this content.